Hi everyone, Kath here. How you going? Sorry it's been a while since I posted a video. I've been procrastinating. So I thought while the kids are busy watching a DVD at the moment and the others are at school, I'll make a video. I had my pre-surgical appointment. First of all, when you first go in, for those of you that are in Australia, what they give you is a card with your first appointment, and then on the back of the card it has what sort of surgery you're getting done, and on the back of your card it's got your personal details and that, so I'm not going to show that for obvious reasons, but yeah, a bit grotty, but it's been in my purse for a while. I had my pre-surgical appointment on the 16th of September. Everything went fabulously. Apparently I am the most healthiest person that they've had ever to have this surgery. So first of all, I went in and they weighed me, so I got to sit on this big chair that weighs you, obviously, and I was 121 kilos at the moment. And then I went and saw my dietitian. I got called in for the dietitian, and she said, right, broccoli and Optifast. You can eat as much broccoli as you want. You need the fibre and Optifast, and she wanted me to have 4 meals of Optifast per day. But yeah, snack on broccoli. And then I went and sat down, and I thought, oh, maybe I should tell them that, that I've finished with that appointment. And what happened was when I first went in, they gave me a blue form with about a dozen boxes to get ticked. So for each person that you saw, you got a tick. So, obviously I got a tick from the dietitian. And they said, oh, no, you don't need to tell us after each person you've seen because they all know you're here. So I was the only person in for gastric bypass that day. Anyway, next I went in and had my ECG done, and they told me to take my shirt off, and male nurse and female nurse, and I'm like, oh, okay, I'm not real fussed, there's a door here, had 5 children, been seen naked before, don't care. So they, by the time he put the 10 little sticky things on me and plugged me up, and I said to him, can I just have a sheet, I'm a bit cold? And he said, oh, you don't need one, I'm done. I'm not kidding, it was probably 20-30 seconds tops that he checked, and I think it's to check that all your arteries, there's no blockages to your heart. So that was all fine. Then I went out into the waiting room again, and then I was told I'd be there up to 4 hours, so I leave 4 hours spare. But then as soon as I sat down, I got called again, and I got called in to see the anaesthetist, and he explained to me about the self-doser that they're going to give me for when I wake up. And he's got, I think there's 4 different chemicals in there, and he gave me a piece of paper and he said, right, there's half a dozen faces on this piece of paper. I don't have it with me at the moment, otherwise I'd show you. And the best one was a big smiley face, and the worst one was a teary, like, oh, face. And in the middle there was a face with a straight line across, and he said, right, we don't want any heroes. Wimps get out of hospital sooner. As soon as you get to that face, I want you to self-dose. Don't be a tough girl. Don't wait till you get to the distress face, because you'll be wriggling around and in absolute agony by then. Don't wait till then. Take it at this face and all will be good. You'll get out sooner. Oh, by the way, you'll probably be in for up to 8 nights. And I'm like, oh, okay. Okay, holiday from the kids. Exciting. Anyway, so after speaking to him, and he was wonderful, I went out, and then they called me in to see the doctor, one of my surgeons. He was a trainee surgeon because my doctor wasn't available at the moment. He's opened a clinic, or overseeing a clinic now in India, and he's also the head of bariatric surgery worldwide at the moment. So very busy man, but he obviously wasn't there. So I saw the trainee and he was just a cracker. He was just the best. I bet the man $5 that because he asked me how I go with scarring. I bet the man $5 that he couldn't find my C-section scar, and I won. I had to point out the only I'm very lucky, because the only proof that I ever had as a cesarean was 2 little dots from a staple that got infected a couple of days after the C-section. So you know, he was very impressed with that. I was very impressed too, because he thought he was going to win the bet, and I won. But he said that I'll probably only have 4, at the most 4 holes in my belly area, simply because it's not, well, to put it basically, the fat's not really compacted, it's quite loose. He couldn't feel any hernias, you know, because it's quite loose, you could feel around really well. So he was really pleased. He also asked me if I'd like a catheter or not. It's my choice. And I said, let me see, do I want to wake up after surgery going, I need to go to the toilet? Or do I just want to lay there and chill for a while? I thought, no, I'll have a catheter, please. You know, so I figured they're going to be pumping me full of antibiotics anyway, so the chances of me getting an infection, a urinary tract infection, are pretty, you know, if I did, then it would be cleared up with antibiotics, so it's not a problem. And then I went out and I was expecting to have scans done to check, you know, to check internally, and they decided I didn't need that, and then all I had to do was go down and have blood work done, and that's it. And so I was probably there for about an hour and a half at the most. So it was bang, 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 bang. Quickest. I don't think I've ever seen this many specialists all at once so quickly. Usually waiting on huge waiting lists, and I guess it's been nearly 3 years, so I have been on a long waiting list, but yay! Yeah, so I went home, and then 2 days later I spoke to my booking nurse, and he said that he'll get back to me with an appointment date, and then last week I got my surgery date, yay! Which is the 12th of November, babies! Yeah! So I'm really happy about that. So it's only 4 weeks off. So 1 month, 2 days. Not like I'm counting or anything. And he also said I don't need to be on Optifast because all my blood works were fine. My weight is perfect for the operation. The doctors were really happy. So I'll probably go on a few days beforehand. You know, anything up to 2 weeks, depending on what the doctors end up telling him to get me to do. But I may only have to be on it for 48 hours beforehand, just to clear out my system and that. So that's about it. But I have to make another video in a minute because I want to show you us Aussies some of the things that you need to get for after the surgery, and yeah, so I'll make another video in a minute, and yay! Bye!